Hi, good morning, Lance. My name is Terry Milan. I'm your invigilator for the OET speaking session on the 8th of April 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Lance Stainer.
And what is your candidate number, please?
My candidate number is 235899710.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What are the biggest challenges that nurses face today?
In my opinion, the biggest challenges and issues nurses facing today are mandatory overtime, safe staffing levels, and workplace safety. The current nursing shortage has led to potentially dangerous practices like mandatory overtime and unsafe staffing levels. This increases the stress on nurses, decreases the quality of patient care, and increases the likelihood of medical errors.
How do you practice self-care?
The job of a nurse is very challenging. Along with the emotional pressure, there may be some other issues, such as job timing, night shift, etc. So, we have to be fit and fine for this job, to be available all the time. That's why I exercise and meditate daily. Along with this, I have some stress-busting hobbies, such as gardening and cooking. These all help me a lot.
What do you find the most challenging part about your job or being a nurse?
The most challenging thing I have faced in my nursing career is feeling helpless. I have to provide as much care and comfort as possible, but sometimes you can't do more. Seeing someone in pain, or feeling miserable, and knowing there's nothing you can do to help, is the most challenging thing I have to deal with. As a nurse, you have to care about people, and help them genuinely, but when I can't, I feel uneasy.
What do you think about effective patient and family education?
Effective patient education is needed to satisfy the patients and their families. Every patient has their own learning style. So, we have to understand their learning style and adapt accordingly. For example, some patients want to read the complete medical instructions and detailed information. On the other hand, some just want the necessary information. So, we have to figure out what each patient needs. It is very important to include the family in the treatment process, because they are the main caretakers for the patient in future. So, it is our duty to explain to them all the process, and tell them how they can help the patient.
Have you faced a situation where you were under a lot of pressure?
In my previous job, I worked as an ICU nurse. I have experienced a lot of pressure every day in that job. Sometimes, I had to cover more patients than usual, in the absence of other staff nurses. To manage my increased workload, I decided to create a list and priority of care. By organizing and paying attention to detail, I was able to manage things successfully. I also practice yoga, so that I don't feel any stress.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET speaking role play. Don't worry if I stop you when the time is up.
Good morning. My name is Lance Stainer. I am one of the nurses working in this clinic. May I know your name for the record, please?
Good morning, Lance. My name is Terry Milan.
Hi, Terry. Can you please confirm the reason for your visit?
Yes, I am here for a blood test to check for anemia.
Thank you for your confirmation. And Terry, how do you feel now?
Well, I am feeling tired and a bit concerned, in case I do have anemia. And nurse, what do you think about the chance of I being anemic?
I acknowledge your words. Terry, your concerns are quite understandable. But, I am sorry to say that, I am not the authorized person to provide the diagnosis. Moreover, the blood has to be tested first, and need to get the blood test results for making the diagnosis. So, for the time being, be relaxed, Terry, it will be alright.
Alright, nurse.
May I know, do you have any other concerns to be addressed before I take your blood?
Yes, nurse. It is nothing but, I have had blood taken before. During that time, the nurse had difficulty getting it from my arm. That is why, I am a bit worried that it may happen today as well.
Your anxiety is quite reasonable, Terry. And this is one of the common concerns, which is seen among the people who come for the blood test.
Oh, is it?
Yes, Terry. Moreover, what I can assure you is that I will do my best to avoid multiple pricks. Do you feel confident now?
Yes, nurse. That's so kind of you.
It's my pleasure. Well, before moving on to the procedure, I can explain to you some of the reasons for finding it difficult to get blood.
Sure, I would like to know about it.
Great, I am glad to explain it. One of the main reasons for the difficult blood drawing is low blood pressure. When blood pressure is too low, not enough blood reaches all parts of the body. Another reason can be due to dehydration. While caffeinated drinks may have a mild diuretic effect, meaning that they may cause the need to urinate. Thus, too much caffeine can result in loss of fluid through urination. Therefore, before taking blood, I will give you some time to get yourself hydrated with enough water. Is that okay for you?
Thank you for your consideration. But nurse, I can let you know that, this time I had enough water, and haven't had any of the caffeinated products. Hence, I think there won't be any such problem. And you can move forward with the procedure.
I really appreciate you for that. Now, I will outline the procedure for you.
Yes, you may please.
Firstly, let me examine your left and the right arm, and try to use a vein in the hand or upper arm. Because the usual sites for taking blood are the right or left upper arm or from a vein in the hand. It is to make sure sufficient blood can be drawn in a single attempt.
That sounds good, nurse.
Thank you. Next, I will clean the area chosen with an alcohol swab, and then draw the blood from the selected site. After taking blood, I can give you a swab to apply some pressure, and also provide a bandage if it is necessary.
Thank you for your great explanation. Now I would like to know when I can get the results of my blood test.
I appreciate your question. It will take up to 2 to 3 weeks to get the blood test result. Once the results are available, you will get a follow-up appointment from the doctor. After the evaluation, the doctor will prescribe you some treatments to be followed, according to your condition.
I got it, nurse. But, what I really thought was that I could get the results straight away.
Your thoughts are quite natural. It is usual to take this time for the result. After taking the sample, there are some normal steps to be followed. Initially, it will be sent to the laboratory for analysis. Afterwards, the analyzed clinical data will be forwarded to the doctor. Thus it requires 2 to 3 weeks to complete the process. I hope I am clear to you.
Yes, you are.
Thank you for your understanding. Terry, now I need your consent to take your blood sample.
Sure, nurse, you can proceed.
All right, thank you for your cooperation. I will come back with the necessary things for blood collection.
Thank you, nurse. That is the end of your Oichi speaking roleplay. I wish you all the very best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.